Here in the Piedmont Triad, we're all connected by the ideas, innovations, and people working to improve our region, from transportation and planning to housing and economic vitality. We bring those conversations to you. Welcome to the Triad Regional Connections podcast, hosted by Audra Adams and Lamar Powell, brought to you by the Piedmont Triad Regional Council. Hi, and welcome to this edition of Triad Regional Connections podcast. My name is Audra Adams, and on this edition, we are pleased to welcome Jeanie Schepisi, who is Field Operation Manager and Central Regional Manager of the SHIIP Division. And if you don't know what that is, it's okay. We're about to break it down. So here we go. Welcome to the podcast.
Hi, Audra. Thank you for the invite. It's so nice to be here with you guys today.
We are excited to have you. And right before we went on camera, you were explaining so many things and really unlocking a world of questions that I have and that I'm sure our viewers and listeners are going to have. So first of all, let's start out with just tell us what you do.
Perfect. So SHIIP, SHIIP, stands for the Seniors Health Insurance Information Program. It's a division of the North Carolina Department of Insurance that was created in 1986. So in September of 2026, we'll be 40 years old. So we've been around for a while. Yeah. And interestingly, there are still people that do not know who we are and what we do or that we even exist. So we want to make sure that people not only know about us, but we want them to know about us before they actually need us.
Sure.
So we are an agency, a state agency that assists people that are on already or going on Medicare, regardless of age, in a neutral, objective, unbiased fashion. We're not insurance agents. We don't receive commissions. We don't sell insurance. And not that that's wrong or bad. That's just not what we receive state and federal funding to do. And we tell people what their options are after gathering information, because we realize that everyone is different. Everyone's needs are different. Their wants are different. Their financial situations are different. So we get an idea of who they are and then provide them with information so that they can make good decisions that they feel comfortable with and confident in.
So I want to jump in right off the bat because I think that is so important, because there's so much confusion about Medicare, and you're getting phone calls a lot of times from agents, and you don't know if that information is totally correct or non-biased. So what our state provides through this organization that you are a part of, SHIIP, is a non-biased way to educate our aging citizenship on what all this is about. And you can get information, like you said, from them, their circumstance, where they are financially, all those other important elements, and give them advice, right?
Assistance. Yes, assistance, right.
Where to go.
And even if the information that is being given to them is correct and accurate,
right,
is it the best option for them? And just to let you know, if someone gets a call from an agent or an insurance company or even like a robocall, if that is not asked for by the client, the person, that's illegal. That's a cold call, and that's illegal. And it's often difficult for that to get reported or a complaint to be filed because they don't have that person's information. So we just tell people, if people call you and start talking about health insurance and specifically Medicare related products, if it's not something that you already have, then just tell them, no, thank you, you're not interested, and know that we are here to help you with those kinds of decisions and options. And when people get ready to go on Medicare, either due to age, which is 65 normally, or disability, they get a lot of information in the mail. And I tell people that's called fan mail. And if you come to us for assistance, you don't need to worry about all that fan mail, because we kind of break it down and summarize it for you. So you don't need to worry about all the things that you're getting bombarded with in the mail. We're here to help simplify and explain your options to you.
So and again, I'll let you talk in a minute, but I think that is so crucial. I've gone through that I'm old enough now. I've gone through that the last couple of years, and the information was really overwhelming. And I think I'm a pretty smart guy. You probably won't agree with that, but I think I'm a pretty smart.
Here, minding my own business.
My sister-in-law. But yeah, it was a challenging thing. I wish I would have known this. And I think that's what I want our listeners to understand. This is available to you. It's a resource. And people need to know about this.
Exactly. And you mentioned a couple of words that we hear often. Sometimes when I'll do a presentation, we do presentations upon request or exhibits at events, and words that we hear often are confusing and overwhelming.
Yes.
And we want to take the guesswork and the worry and the overwhelmingness and the confusion out of going on Medicare. Medicare is a great product, and we want people to be relaxed about that, because there are people there that can assist them with that decision making, again, in a neutral, objective, unbiased fashion. And we haven't mentioned the best part yet, because we receive both state and mainly federal funding. Our services are provided at no cost. Yeah. So when you say, I wish I would have known about you sooner, we hear that a lot as well. And that's why outreach such as this podcast are very important, because you might not be turning 65 for a few years, or you might be drawing Social Security disability as a brand new person, and you've got that 2-year waiting period. So we want people to know about us before they need us. And then when that time rolls around, you go, oh, I know who am I going to call?
Exactly.
And so that's what's really, really important.
So for any of those that are out there that truly don't understand what Medicare is, can you just break it down just in an overview?
Yes. So Medicare is a federally funded health insurance program. It's controlled by Congress. Anything you like about Medicare, yay Congress, or if there's something that you think Medicare needs to be made better by doing, then you would reach out to your congressperson. But it's been around since 1966, so it's been around for a long, long time. 60 years to be exact. And it's to protect, it started in 1966 as that federally funded health insurance to protect those persons 65 and over with their major catastrophic health expenses. And then Congress decided by law 6 years later in 1972 that another group of people would be pulled under the Medicare umbrella. So that's when those persons under 65 who receive Social Security disability checks for 24 continuous months are now able to receive Medicare benefits. And so it is a product that can help many, many people, especially those people that may not have employer group insurance or any other option, but they have to qualify, of course. It has nothing to do with finances. That's the cousin program, Medicaid, but you could qualify for both and have both. But Medicare looks at your age and your disability status and provides health insurance. And there's 4 parts, A, B, C, and D. Parts A and B started in 1966. A is the inpatient or hospital part of Medicare. B is the outpatient medical part of Medicare. And that red, white, and blue card that you can picture in your mind, that's original Medicare with those 2 components.
Okay.
And then C, as in cat, was to give people a choice. That's what's called Part C, and it's your Medicare Advantage plans, which are managed care plans. It's a group of healthcare providers that are contracting with an insurance company to provide a plan to cover people. The benefits may be outside of the scope of A and B. There may be some additional benefits that people really like. The costs are usually lower for Advantage plans up front versus A and B. But there is a network of providers that you must abide by. Those providers have contracted with an HMO or a PPO. You can go in or out of network. So a Medicare Advantage plan for people that are interested in those, they're great products for some people as long as they understand what that product does and how it operates.
So the difference between the HMO, PPO,
yes,
is
a PPO has a more flexible network.
Mm-hmm.
When I'm explaining HMOs and PPOs, I draw a circle with a definite boundary and an outline, and I say, this is your HMO. This is your network of healthcare providers. And if you have an HMO as a Medicare Advantage option, you have to stay in that network and see providers that are contracted with that managed care plan, that HMO. A PPO prefers that you stay in network, but the outline is a dotted or broken outline. So they want you to stay in network. And if you do see contracted providers, you pay a copay. But if you go out of the network, which you're able to do with a PPO, you pay a higher copay. So it gives you more flexibility network wise. And then we've got our Part D that's been around since 2006. For 40 years, Medicare did not have a prescription drug plan for outpatient prescription medications. So people paid for their medicines out of pocket, or sometimes they even did without, which is not good. So Part D started in 2006, and it's surprising that it's 20 years old, but it's helpful to a lot of people because it provides that outpatient prescription drug coverage. And for people with limited income and resources, there's an assistance program called Extra Help. And every client that we talk to over the phone or that we meet with face to face, we screen them for their money, situation, income, assets, resources, not to be nosy, but to find out where they are, because we don't want anyone falling through the cracks. And if we think they may qualify, we can do those applications for those assistance programs right then and there, which is convenient and helpful to that client. And not only is it life-changing for people, and they're very appreciative when they do qualify, but it can be life-saving because it can really affect their medication costs tremendously. Or if they qualify for what we call Medicaid or Medicare savings, that helps with their medical expenses, and them not having to pay that Part B premium even is just very, very helpful to that person.
For the first time in my life, that made sense.
Yeah, and we have family that has taken advantage of some of this, and I know it's been a big game changer for them.
Yes.
It's helped them greatly. But the other thing too with all of these, there's premiums associated with some of these parts, maybe not all of them, but touch on that a minute.
And that's important, Lamar, because when we assist people, again, in that neutral, objective, unbiased fashion, knowing that everyone's different, we just want them to have the best coverage for them at the best cost.
Yes.
So those two things are very important. So we do look at, does this plan cover your current prescription medications, and what are the costs associated? And we look at pharmacies because that's very important as well. There's in-network, out-of-network, and preferred pharmacies. And an out-of-network pharmacy's cost for a medicine may be higher than a preferred pharmacy's cost for the very same medication. So we look at that big picture when people come to meet with us. Even if people don't know or think about that, we need to tell them, let's look at several pharmacies, because we want you to not only get the best coverage at the best cost, but we want you to make sure that that network, whether it's for an Advantage plan or prescription drug plan, that it's working. So those things all work together, because people that are on Medicare usually have limited fixed incomes. And even if they're good incomes, they're not what they were making when they were actively working. No. And we don't want them spending too much money on a premium when they can get something else that's equivalent or maybe even better at a lower cost.
So Part A is typically no premium there, right?
And
that's just part of your...
That is correct. So if you or your spouse worked at least 10 years, which Social Security says is 40 credits or 40 quarters, and you pay in, then when you become eligible for Medicare, your Part A is normally premium free. If you didn't work enough or you didn't work at all, then you may have to pay a premium, and there's set amounts for those. Part B, there is a monthly premium for that, and that amount changes every year. Congress decides what that figure is, usually around November of one year for it to start in January. And most people pay that Part B premium. The only way you do not pay a Part B premium for original Medicare is if you've got limited income and resources and assets, and the state pays it for you through some Medicaid related program. And again, that's very helpful assistance. And then Advantage plans, there are several. We're in an area here that there's many options for Advantage plans, and several of them have no premium. So you pay your Part B premium just to be in the Medicare system, but you may have a zero premium for that Advantage plan. Okay. And even if you do have a premium for an Advantage plan, it tends to be lower than that of a Medicare supplement. But those supplement premiums are heavily regulated by our Department of Insurance.
And Part D?
Part D, there usually is a premium associated with that. A few years ago, there was at least one plan that had zero premium. And now there's a plan, I think, that's $360 a month. which is very affordable. So what we do is when people come to us, whether they're new to Medicare or it's open enrollment in the fall, which is the time, it's a 7-week period from October 15th through December 7th, that they're given the opportunity to check the plans because they're changing in January, along with their current prescriptions to make sure that their medicines are going to be covered. And so it's very important, again, that we look at coverage and cost, because you may get a plan that's as little as $3.60 a month that covers your medications. And for people that don't take medicines, you still need a drug plan. It's like I tell people, you might not expect to have an accident in your automobile, but you still need automobile insurance just in case there's a bad driver that hits you.
Right.
So, we try to tell people you don't wait until your home burns down to purchase homeowners insurance.
Right.
Medicare is the same way.
So with now partnering with PTRC through the AAA agency, which is, I don't know it again.
Your
Aging.
Yeah.
Yes. Not to be confused with the car people.
Right.
Yes.
Right.
Yes. But tell me about the overlap there.
So I've been with SHIIP, it'll be 30 years in July. And from day one, I've known about the area agencies on aging across North Carolina. Most of what I do is primarily in the Piedmont region, even though I'm the central regional manager. And so I work primarily with the PTRC area agency on aging. And if people reach out to me, I have friends and family members and neighbors that reach out to me because they know I've been in this business for a while. And if it's Medicare related, I'll say, I'm happy to help you. A friend of mine said, my sister needs help with her Medicare. Fortunately, she's a state employee and it was really quick and simple and easy to help her. But if people reach out and it's a Medicare related question, I can help with that. But oftentimes people reach out, my mom's in a nursing facility and I don't feel like she's getting good care. Or I had recently some friends that reached out. The mother needed to be placed for permanent residence and the father needed temporary for rehab or therapy. So I said, well, that's kind of out of my Medicare scope, but let me tell you about my partnering friends at the Area Agency on Aging. So everything that's not Medicare related that deals with aging, I automatically think of them. I've got them saved as contacts and I have referred many people, and they'll post on Facebook, thank you, they were such a great help. And sometimes I'll give Adrienne, the director, a heads up, I'm sending someone your way, just so that they know. But if it's not Medicare related, that's our go-to for any and all thing age.
And there's a good back and forth there too.
Yes, and I'm sure they refer people to us. We actually have 2 AAA staff members that are SHIIP certified. And so that's they go out and do outreach, and they include the Medicare message and the SHIIP message, and they talk about the assistance programs and how important it is to get preventive benefits under Medicare. And then if they're able, they may counsel someone, or if they get a Medicare question and maybe they don't have time to assist that person, or it's a little deeper than they can handle, then they refer them to, we have a coordinating site in every county. That's what makes our program special and unique. Usually it's a senior center or cooperative extension, the Shepherd Center, Council on Aging. And so if people don't want to call our office in Raleigh, and I can give you that website and toll-free number before we leave. So our office in Raleigh, our toll-free number is 855-408-1212. And that's open Monday through Friday. And that's not just a SHIIP Medicare number. That's your Department of Insurance number. If you have automobile or homeowners or life insurance questions or health insurance questions that are not Medicare related, that's the number that you would call for all things Department of Insurance and Medicare. And we also have a wonderful website that's www.ncSHIIP.com. And it's like a boat, but with 2 I's in it. And so we want people to visit our website. We want people to call us, but we have local people in every county that can find out what you need. And we operate on a certified volunteer counselor program. So people go through certification. We're always looking for people that are interested in learning about Medicare and putting back out in the community. So just contact us for that. But that's what makes our program special and unique is people don't have to call Raleigh. People don't have to drive to Raleigh. They can get help locally right there where they live. And they can also reach out to their area agency on aging, because every area agency on aging in North Carolina has some kind of SHIIP connection. They may have staff members that are certified, but or they may be a coordinating site. But we do partner very closely with the area agencies on aging, not just in this area at PTRC, but all across the state. And that allows us all to assist our clients better.
Absolutely. I mean, it definitely sounds like that. How do you know how that partnership started?
I don't. More than likely, when SHIIP started back in 1986, it probably started at that time, because we were looking for how can we get the word out about our program and what agencies are instrumental in working with aging and disabled populations. I also know that in this area there's a Winston-Salem Council for mayors. Winston-Salem Council for Persons with Disabilities, the Mayor's Committee, that I'm affiliated with. I do go to their meetings, and we have events, and I exhibit or table there. So I'm sure it goes way, way back, because we know that they're very instrumental in reaching aging people.
Yeah, I think that's great. And you guys are also helpful, helping PTRC in their elder abuse walk.
Yes.
You guys are a signature sponsor.
Yes.
Again, another way to get the word out.
Exactly. We'll have materials there. I won't be able to attend, but my contribution is to help stuff the participant bags, and I enjoy doing that every year. But we do contribute materials and giveaways to put in the bag, and we're very, very happy to help sponsor that event, because we know the importance of Medicare fraud, abuse, and waste. In addition to SHIIP having North Carolina having a SHIIP, as of 1992, there's a SHIIP, SHIIP, State Health Insurance Assistance Program in every state. So if you have relatives, say in Louisiana, that need help with their Medicare, there is an organization in Louisiana and all other states that can help them through their SHIP. In addition to that, there's a senior Medicare patrol in every state. I can't remember what year that started. It used to be called Medicare Lookout. And we teach people to protect, detect, and report through our senior Medicare patrol program in North Carolina, as well as in other states, because we realize that unfortunately, Medicare fraud and abuse is out there, and it's wasteful. And you guys can agree with myself that we want Medicare to be around for a long, long time, because we want it to be there in a few short years when we're eligible for it. So it's important to remind people to protect that Medicare number, even though it's not Social Security based anymore. If it gets in the wrong hands, people can file fraudulent claims. Look at statements when they come out. Medicare just started mailing out statements every 6 months now instead of every 3 months. But you can also view them electronically on your Medicare.gov account. So we're encouraging people to create those accounts so that they can actually go in. And we realize that not everyone on Medicare is computer savvy. My dad doesn't have email, doesn't know how to use it. My mom does. But there are people that are. And as time goes on, more and more Medicare beneficiaries will be even more computer savvy. So having the access to the internet programs and usernames and passwords is very, very important. So we do remind people that fraud and abuse is out there, and you can help combat it by protecting, detecting, and reporting. And to report it in North Carolina, you just contact our SHIIP number, and we can take information and help you from there.
I think that's important, because across the nation, we have seen it's come to light how much abuse and fraud that there is. And that's taking dollars from people that need it, programs that are needed. And so I think that's a very, very important part of this.
And I tell people, if they're doing it to you, guess what? They're doing it to other people. And maybe someone's going, well, I'm not going to call because somebody else will call. And everybody takes that opinion and nobody calls, and it continues to happen. So that's unfortunate. So you need to keep your eyes and ears open, and you need to trust your intuition. And don't just assume that like, I don't want to say that healthcare providers do wrong and bad things, but they do. Medicare beneficiaries do wrong and bad things. So you just need to keep your eyes and ears open and trust your intuition.
And again, one of the biggest challenges that we see is the funding for a lot of these different programs dealing with the aged, and those resources are needed, and fraud does not need to be a part of it.
Right. Our program, our SHIIP program, actually was in jeopardy on both a state and federal level. And so we reached out and we, asked people to help support us, and hopefully that worked and will continue to work, because again, we've been around for almost 40 years here in North Carolina. And I'm like, I can't imagine not having a program like ours to help people with Medicare and to identify Medicare.
So where do you go to create that fund opportunity?
We are state funded because we started out as a state agency in 86. So we only received state funding from 86 to 92. And then in 1992, when the federal government mandated that every state have a program, they used ours as the model, actually. We were the second program like ours in the country. The first state was the state of Washington. But when they required by mandate in 92, they used our state's program as the model to create SHIIPs in other states. Now, they all look different, but they said, here's what North Carolina's doing. Everybody has to have a program like that. And that's when we started receiving federal funding. But you all know, with things being looked at, and it's like I tell people, you have to prove your worth and your existence. So when we help a client, we have to key that information in a federal database to show, here's what we did, here's how many people we helped, and here's the money that we helped that person save. And when you look at the cost savings that are documented, we actually help people save more money than our program cost on a federal level. So what does that tell you, right? So again, I just can't imagine not having a program like ours to help lessen the confusion and make Medicare not so overwhelming, because that's exactly what Medicare is.
Well, I think that's why we want to get the word out about this, and I appreciate Adrian suggesting you. And my mind's blown. I wish I'd have known this a couple of years ago.
We hear that.
Exactly.
And it's interesting because, again, I have been doing this 30 years in July, and I at some point had 20 some counties, and now I'm the lead of our team, so I only have 9 counties. But I'm out doing a presentation, and I'll ask how many people have heard of SHIIP before, and when they raise their hands, I used to look at that as like, I'm not doing a very good job, because there's all these people raising their hand, and I've been going everywhere and talking all the time. And then I look at it as an opportunity, because what I compare it to is College Foundation Incorporated, if you will. I have 2 children, and one will be 25 in November and one will be 34 next month. And College Foundation Incorporated, they could have talked to me all day when my kids were younger, and it didn't have any bearing on me. But then as they kept on talking and my kids got closer to that college age, then they were important. They were on the front burner. And so I look at it as, there's people that are going on Medicare all the time. There's family members that are helping their family members, and they're perking up looking for people to help. And so now I see it as an opportunity, not I'm missing people and I'm not doing a good job, but and that's a cool thing, is there's all these people that want and need that information. Again, we want them to know about us before they need us, because we can help people make good, sound decisions up front.
And it's a scary time. I've had family that been worried to death. I don't want to make a wrong decision on my coverage and all of this. And if we could have had someone to talk to, which we do now, we know.
Yes, we do.
Awesome. Thank you.
I thank you for being here today and sharing
guys.
This wonderful information.
Hopefully it, reaches the right people, and to advocate for some funding as well as your volunteers, and to be certified in that, and just all around get that word out.
If you've ever been assisted by SHIIP, no matter what state, let your elected officials know how it's touched you. Testimonies are very important. And again, I can't imagine us not being here to help those people. Every year during open enrollment in the fall, it's a 7-week period. I go to Senior Center in Kernersville. I go to other aging agencies across my area, and we help a lot of people. I tell my husband it's like tax season for an accountant. That's what it feels like. But helping all those people is rewarding because, again, you're helping them find the right plan at the right cost. And then I stop and think, what about those people that don't come in?
Yeah.
They're paying more than they need to, or they don't have a good plan. And it just really bothers you.
Yes.
And so we want everyone to know that SHIIP is here. And please reach out to us. That's what we're here for, especially in the fall during open enrollment. We could do another podcast then just to talk about that, because people need to know the importance of really investigating what you have and making sure it's the right fit for you.
Well, I think you're a great spokesperson for this.
So
and
much.
You know your stuff, and you can tell you're very passionate about it.
Thank you very much. I appreciate you guys allowing me to share the message today.
Absolutely. And we'll have you back whenever you want to.
Thank you. That sounds great.
And with that is our episode. We want to say thank you so much again for joining us. If you have any questions, look at the resources that'll be on your screen and use them. If it's not for you, you know someone that it is for. So we would encourage you to reach out. And with that, we'll see you on our next edition.
See you next
Bye-bye.
time. Bye.